Welcome to the Aesthetic Doctor podcast. We don't shy away and keep secrets here. We empower you with education, telling you the truth about all things aesthetic medicine while encouraging you to be the best version of yourself. It's time to look great and feel good doing it. This is your host, mom, speaker, and board-certified physician, Dr. Judith Borger.
Hello, friends, and welcome to episode 45 of the Aesthetic Doctor podcast. I'm Dr. Borger, and today we're going to be talking about melasma, which is a fairly common condition where I think there's a lot of education needed because it's a complex one. And to talk to us about melasma, we have not only one, but two board-certified dermatologists here. Please join me in welcoming the co-founders of Clara Dermatology in Chapel Hill, Dr. Rebecca Bialas and Dr. Joanna Hooten. They both completed their dermatology residency at Duke University in North Carolina. They're both board-certified dermatologists. They have both done extensive research work and authored medical journal articles. They're accomplished laser surgeons and they're today's experts. I could not be more thrilled to welcome these two amazing women and doctors to the podcast. And on top of that, they're beautiful, they're fun, they're smart, and they're a powerhouse. So Dr. Bialas, Dr. Hooten, welcome, and I can't wait for our discussion on melasma. Hello. As I said, we have a total treat here. We don't have just one, but two board-certified dermatologists. So hello, Dr. Bialas and Dr. Hooten. How are you today?
Hi,
Good.
we're great.
Glad
Thank you
to
for
be
having
here.
us.
Yes. So, we're going to talk about melasma today. And I feel like melasma is one of those things that is like the bane of the existence of the sufferers. And you and I, we're both in North Carolina. We're sort of practically neighbors. And especially with the amount of sun and the amount of heat that people get in melasma, in North Carolina, melasma is just such a huge problem. So thank you so much for coming to talk about it.
Yeah, we're glad to talk about it because, like you, we see a lot of women in particular with melasma. And so it can be a really rewarding thing to treat and also very frustrating for a lot of patients. So I think
So
it's
we're
important.
here to kind of clear some things up and bust some myths and really explain to people what melasma is, what it isn't, what are realistic treatment expectations and what aren't. So just starting out, what is melasma?
Well, melasma is sort of a muddy, brownish discoloration of the skin. Some people, you might have heard it called the mask of pregnancy, and it has been called that because it's related to hormones. But that is a bit of a misnomer because men can get melasma as well. So typically, it's this sort of muddy brown discoloration, commonly on the upper face, like forehead, cheekbones, around the eyes. And it's due to a combination of, as I said, hormones and typically sun exposure as well.
Mm-hmm. And it can also encompass the neck, I think.
Yeah.
And then there's certainly a genetic predisposition in darker skin tones in the Asian and Latin American continents tend to have a little bit more of predominance of it. And I think there have been some studies showing even first degree relatives that have a good case of melasma can have a 50% incidence in first degree relatives. So I think those are also important things to keep in mind as far as risk factors.
Yeah, you actually just went into my second question already with this. So in terms of what predisposes people to melasma, so we've covered genetic, we've covered hormones, like we said, it is not exclusive to pregnancy and it's not exclusive to the sort of mask like that is described. We've talked about sun and heat exposure. We've talked about genetic stuff. What other, or Asian descent, which is also a genetic risk factor, what other things come to mind in terms of what makes people get melasma?
I
Go
think
ahead.
I think think you've hit all of the main
Yeah,
ones.
the
Yeah.
biggest ones are sun. I mean, and what we'll get into later, I'm sure, when we talk about our approach to treatment. I mean,
Yeah.
UV light is the biggest thing, I think. And then a predisposition, which is commonly hormonal fluctuations. So I mean, to be a little bit more specific, but I think pregnancy, menopause, contraceptive
Yeah.
pills, again, those don't happen in men so much, but in women, we tend to see those corresponding to times of development
Yeah.
or more prominence of the pigmentation. So I would say those are the two biggest risk factors, in my opinion.
I agree.
And even though we have talked about that men can get it as well, which some people might not be aware of, as far as I understand it, it has a very sort of female predominance overall, correct?
Yeah,
Yes.
that's true.
All right. So now, are there different types of melasma?
I think that I consider melasma to be multifactorial from a pathologic standpoint of what factors are going on in the skin, but I usually consider it to be a specific diagnosis. What do you think?
I agree. I don't categorize it as different subtypes, but we definitely like to make sure that when we're talking about melasma and its causes, that we address all of the variables that contribute to it. So I agree, multifactorial is a good word.
Yes. And for those lay persons, it just means caused by a variety of factors, like there's
Right.
not just one thing that pinpoints it, but it's a combination of others. Of course, if you are pregnant or having hormonal fluctuation and you have the genetic risk factor and you go out baking in the sun, that's sort of like three things that would definitely put you at the highest risk. You briefly went into sort of your approach and your treatment. Would you tell our listeners more about that?
Yeah, I would take a step back and talk about what happens at a cellular level first,
Yes,
or
please do. Please do.
within the environment of the skin. So what we see is the muddy brown discoloration and pigment, but and what pigment comes from, the cells that make pigment are melanocytes. So those are the primary pigment producers. But what we have come to know over the past, few decades is that it's a very complex interaction between the resident skin cells called keratinocytes, the melanocytes, the vascular cells or the endothelial cells, and then other inflammatory cells like mast cells. And so there's a very complex interaction between the external stimulants like sunlight and hormones that stimulate a very complicated interaction between all these cells that causes the increased pigment deposition in the skin. So, with that in mind, I think we then want to approach treatment and have newer options for treatment in for each variable, if that makes sense.
Yeah. And then in terms of approaching treatment, I think that there are sort of different modalities that are commonly used. And the first one that we usually talk about with patients are topicals. Topical creams can be things that are prescription and can include hydroquinone, for example, which is a traditional lightening agent. And then there is a whole host of more sort of botanical based ingredients that we now know can be great at evening out the skin tone as well. And that can include things like azelaic acid, kojic acid. It can include some other things like arbutin, those kinds of things that you would be putting on topically. And that can be a good place to start. When it's needs a little bit stronger topical preparation, we will typically have a cream compounded that contains a high strength of hydroquinone with some tretinoin as well, which is a retinoid, and that can help to have the skin cells turn over a little bit more quickly. And then ours also has some kojic acid in it as well. So combination products can be a good place to start.
And I think that the hydroquinone, the kojic acid, the arbutin, those inhibit melanin synthesis. So that gets at the pigmentation that I was alluding to earlier. And then for the vascular component, the increased blood vessels, that's another target that we can use to help improve that, because if you can only improve the pigment, the blood vessels are still overactive. That'll continue to stimulate the melanocytes to produce more pigmentation. So we can use things like topical steroids if we're talking about topicals, adding a topical steroid to some of the compounded creams that can help and have been shown to be more effective than just the pigment suppressors in general. And then we yeah.
What about vitamin C? I feel like a lot of the products also try to contain some vitamin C. Is there any evidence for vitamin C helping?
I think that that's a great point because another area is antioxidants. So I think we both recommend that our patients use vitamin C every day to protect our skin from the free radicals and the stressors in the environment as an antioxidant shield. So I think antioxidants, because they can protect from the UV light and from environmental stressors, play a key role in stabilizing and preventing some of the damage that can stimulate melasma. And vitamin C is the most common one. There are
Right.
other ones that are green tea derivatives and plenty of, including, even zinc can be more antioxidant driven. So I think that definitely plays a role in the protective component of treating melasma.
Yeah.
And in every patient needs a vitamin C antioxidant.
All right. Take home point number one, whether you're suffering from melasma or not, every patient needs a vitamin C. And I just wanted to say, I love how you guys talk about it because I think it really gives our listeners such a impression of why it's so important to go to an expert, right? Is to not just like order some random stuff online and just slap it on your face, that there's people like you out there that really dedicate their lives to studying this on such a deep level. And I guess I'm wondering if this complex cycle you ever had to draw on a whiteboard to study for some boards, but totally, right? All the cycles we used to draw at some point and knew how to draw. That there's really a lot of informed decision making that goes in there, and also that like one size approach doesn't fit all.
Right.
Yeah, we take a tailored approach to every patient, and I think that really starts with listening to them, knowing what their history is, delving in with specific questions that come only from experience and studying and real world experience, and then formulating a plan. I mean, and often there's, as you said, that plan changes based on response, and knowing how to tailor it after the first application is important too.
And also in things like, how much is the patient willing to do? Like, what's their budget? Are they going to be compliant? Like, are they going to do X, Y, Z? Does smoking affect the melasma, sort of the incidence of melasma at all?
I usually say with smoking, smoking is pro-inflammatory.
Yeah.
So it's going to increase all of the underlying inflammation in your entire body, and anything that has inflammation as part of it, which is most every skin condition, can be exacerbated by smoking. So, I mean, I think it does play a role. I don't know how much research has defined that, but I'm certain that it does. Yeah.
Okay, so we've hit the topicals. So that's sort of first line. And most of the time that's sort of a sort of an easy way. If somebody comes to your office, you evaluate them, you either, compound prescribe or whatever them a topical to use. What are some of the other options for treatment?
Well, we like to layer here, as we mentioned. So we will often have someone start on a topical and then offer a procedural type treatment as well. So that could look like a chemical peel. That is something that we commonly use in melasma. And time of year matters here. So you were saying, that there's lots of reasons to go see a specialist, and there's lots of things to consider. One thing to consider is time of year. So we will tell a lot of our melasma patients to come in for a chemical peel in the later fall. Here in North Carolina, that usually means end of October by the time
not Labor Day.
Yeah, but a chemical peel is not something you want to do in the midst of summer when you're getting sun. So after things have cooled down a bit, a chemical peel is a way that we can use higher strength alpha and beta hydroxy acids, some other antioxidants, either alone or in combinations, to do a nice peel and to really lift up some of that pigment from the skin. Again, we like to have patients pre-treat with a lightening agent before the peel to get best results. So that's another reason to sort of layer these treatments.
Mhm.
Yeah. And then other procedural
Yeah.
things.
The other two things that I typically discuss at upfront, because I like to give a broad array of what the landscape looks like, and then narrow our approach. But microneedling is another great option for patients, and where we make new channels that collagen can then get stimulated in. And I like to often put tranexamic acid, which is something, one of the ingredients we haven't talked about, but it's a great treatment both topically and orally for melasma patients. But I like to put that on after microneedling, and that has shown, I mean, it's wonderful, and you get a little bit of collagen boost along with that. So it's often twofold, but it's very helpful for melasma patients. And then vascular laser, as I talked about earlier, the blood vessels are increased in melasma skin, and they contribute to this back and forth stimulation of pigment production. And by treating those vessels with a laser that targets those and diminishes the concentration of them, can really help too. So those are two other modalities that I think can be really helpful. And then oral tranexamic acid.
Yeah. Yes, oral tranexamic acid is a relatively new treatment that we have started to use off-label for melasma. So it is often used to control bleeding in the operating room or for women with heavy menstrual periods. And we found, actually, we don't truly know how it's working in melasma, but we think that it's because it has an effect on the vascular component of melasma. And so it's a pill that you can take by mouth. Typically, people will take it twice a day, and you can take it for short periods of time to sort of clear the melasma. More and more people are having patients take it over longer periods of time to stay clear. And it's a great way to, again, fade that pigment. And we think it works by targeting the vasculature.
Mm-hmm.
Awesome. Yeah, one of the things I want to talk about too, in terms of treatments, and I love everything that you brought up. And, in our office, we have a melasma peel as well, and we pre-treat with hydroquinone, we microneedle with some TXA as well. And then, the one thing I would love for you to address is, I think especially if you have melasma, you have to be really careful to not go to somebody who will hit you with the wrong kind of laser, or who will mistake your melasma because they're not as knowledgeable for like sunspots and hit you with an IPL. The only other laser that we use that there has been some evidence for is like the 1550 frax wavelength. And so out of, my lasers, the only ones that I will use are the ones with the high wavelengths, because there has been some evidence too that they can help melasma. But really what I've seen, and again, because this is sort of a medical educational podcast, is that I really would love to briefly address how important it is to go to somebody who knows what they're doing, and that are not going to see your brown and be like, oh, all brown can be targeted with an IPL, because that is like the worst thing you can do for somebody's melasma.
Yeah. And I think
we agree.
intense pulse light is what IPL stands for, and that's visible light. And so UV and visible light can worsen melasma. So it is very important to have somebody who knows what laser technologies can be helpful and what can be harmful, and to be able to have that discussion with you. So I think that is critically important, which is,
It's not an uncommon thing. I would say we get a lot of melasma
Mhm.
patients who come in and ask about using a laser to treat their melasma. So there is a lot of education to be done there. And sometimes it can be tricky to, talk with a patient about what kind of pigment they have and get to the root of what the issue really is. But you're right. We definitely don't like to use IPL for melasma. I think we as dermatologists are getting better at figuring out which wavelengths and which devices are safe in melasma. And there are some, as you mentioned, that you can use with the right settings in experienced hands and get good outcomes. But in general, I think that you've got to be careful with lasers, and especially anything that produces heat can also be a trigger for melasma.
Yeah.
And I always also say, backing up all the way to almost the beginning, that there's not a cure for melasma. We are not curing it. We are controlling it and suppressing it. And the single most important thing is sun protection. I mean, that is the cornerstone of all of these treatments to be successful. So without that, none of this, I mean, it's all a drop in the bucket if you can't do that.
It's almost like we scripted it, because that was actually going to be what I was going to go in next, is that, I think some of it is also realistically to set expectations that even if you can clear somebody's skin up and you can clear it up quite dramatically, it's not you're destroying the melasma forever and it will never ever come back. Like you said, we're controlling it, but for people that are prone to melasma, it is a chronic, recurrent thing, correct?
Right.
They
Absolutely.
will always have the tendency for it. Always.
And yes, another plug for sun protection. Tell us why sun protection and what kind of sun protection you recommend personally.
Well, Joanna alluded to this, but basically we want to make sure that we're protecting against both UV light and visible light. So what we prefer for the UV part of that is a physical blocker. Typically, we'll recommend products made with zinc oxide and titanium dioxide. They give the most broad spectrum protection against ultraviolet light. And then the key part is that you want it to be tinted, because the tint is made with iron oxide. And iron oxide is a compound that protects against visible light. So
I have no idea. Like this, I just learned something. This is amazing. Keep going.
Good.
So a tinted physical blocker, it's great. I mean, it's doing double duty, because a lot of times a physical blocker can leave a little bit of a whitish look on your skin. So you almost want that tint in there for cosmetic purposes anyway. But it's really serving the purpose of blocking visible light, which we know can also contribute to melasma in the skin. So we say SPF 30 or higher, physical blocker that contains a tint. That's what you want to use every day, even when it's rainy, even when you don't think you're going to go outside. You've got to get into the habit of putting it on your whole face. And as Joanna said, that really is the cornerstone of any of these other treatments that we're going to layer on top.
And I mean, they can also do a blocker with a tinted powder, so that they're getting a layering effect. But that is essentially the similar idea. I think I discuss barrier clothing a lot too. So wide brimmed hats, and I mean, we're talking about the face, so rash guards are not going to be effective for that, but wide brimmed hats and things that shield the actual sun from hitting you, anything that creates shade, I think is really important too. Avoidance in peak hours. From here, I feel like it's 9 to 5, but traditionally 10 to 4. And then I like to recommend kind of some herbal supplements too. This is going back to the antioxidant protection that can
Tell us
help.
which ones.
HelioCare or something like Inner Glow, which have a lot of antioxidants in addition to Polypodium leucomoides, which is a fern extract that is essentially an antioxidant that provide a low baseline SPF for hours, not enough to protect you without putting sunscreen on, but an additive bump in your SPF protection.
Yeah, we carry HelioCare too. So I love that you just shouted that out. Yeah, that's awesome. What else did we not? I mean, I feel like this is like a jam-packed episode so far already. What else about melasma did we not cover?
I think we covered a lot of it.
I would say, you want to find a dermatologist that you really have a good relationship with, because this is going to be something that you're working on, for years, and you're going to get into a rhythm where, maybe every fall you come in for your peel, and then you do some microneedling, and, throughout the summer you're using your topicals. So I think it's just really important to stress that you want to find somebody who you feel comfortable with, who you're going to be able to work out something that works for you in your life, to keep your skin clear.
And also I love that there's, just again, that stressing up expectations that it's not a cure. It's sort of like aging will always progress, right?
Yep.
We'll always get some sort of UV exposure, no matter how hard we try. And really, there is no true cure for melasma.
True.
Right. But there are lots of ways we can improve it. So you
Yes.
should not give up hope and definitely, come in and meet with a dermatologist who can help you talk through all
Yeah.
these options.
Yeah, we have
Definitely.
had great success, and it's a
Yeah.
very rewarding
Yeah.
condition to treat, and we have lots of happy patients. Um, and
And
they're
I
living.
love that we talked about all this, because I think too, like, it tells people how much there can be done, because they might have ordered like one cream online ever and it didn't work, and then they've totally given up and been like, oh, this is just what my face has to be. So just
Yeah.
the fact that you alluded to all of these treatment modalities that in skilled hands like yours can really make a huge, huge, huge improvement.
Yeah.
So, questions
you.
I ask everybody, especially as you do a lot of cosmetic dermatology, what is your favorite procedure each to get and to perform?
Oh, that's a good question.
Yeah,
What do you think?
I am trying to, this year I've been really trying to have some light CO2 resurfacing done throughout the year. It's great for collagen stimulation. And I also like to do that. I
Mhm.
like
Yeah.
vascular laser and microneedling a lot too.
Mhm. One of my favorite treatments to perform is what we call the photofacial, which is IPL or BBL broadband light. And I think that is a really
Yeah.
fun thing to do, not for melasma, but
Mhm.
great for sunspots. I'm also a big fan of Sculptra. I
Mhm.
love how natural it looks and how great of a job it does just doing full face volume restoration. Those are
Yeah.
two of my
I love
favorites.
those too. It's
Yeah.
hard to
It's
pick.
hard to pick.
I know it is hard to pick. What about to get? So you said CO2. What is your favorite to get?
Yeah, I think the laser resurfacing is my favorite to get. I think it really gives you such a nice glow afterwards. And you know that you're like in it for the long game, like you're stimulating collagen for the future.
I think it's important that it's same as melasma. It's all a long-term process. So a couple times a year for 5 to 10 years from now is when it really, well, sooner than that, but it really shows.
And also Botox. I mean,
Yeah,
we love our
seriously.
That's
Botox.
normally the answer. People are like, with or without toxin, because
Yeah.
I don't want to go without my toxin.
Yeah.
So that's a
I
given
just
at this
dismiss
point,
that
right?
to, it's already implicated that that is like everybody's go-to.
Well, thank you so much. Now, for my listeners in the Greater Triangle area, would you just share like how they can find you, what kind of a practice you have, and what are the ways to connect with you? And we'll obviously put everything in the show notes.
Absolutely. We are a practice in Cary. We serve Durham, Raleigh, Chapel Hill. And our website is claradermatology.com. That's where you can find all of our treatments and pricing. We also are on Instagram at clara.derm and Facebook as well.
And TikTok.
And TikTok.
Ooh.
And we try to be really active in those locations and post a lot of our work.
It's really easy. Our website is very easy
Yeah.
to
It's a beautiful website, by
navigate.
the
It's
way.
very easy to book online, but we're happy to respond to emails or DMs anytime too. We're very active and
Absolutely.
engaged in that.
Absolutely.
And
Well,
we
thank
do,
you.
all dermatology. I think that was another, yeah.
Oh,
So
yes, you guys do all sorts of dermatology. You do
Yeah.
a lot of cosmetics, but you do a lot of non-cosmetics as well, correct?
yes.
Yeah.
All right. Well, thank you so much. Thank you for clearing up everything about melasma. This was really such a treat, my listeners and I, because we get so many questions. And one of the biggest reasons for me for having this podcast is also that I feel like people get so much education from social media, TikToks. We laugh about TikTok, but it's amazing how somebody with like 10 gazillion TikTok followers can put something crazy on TikTok and suddenly like everybody believes them. And
True.
so I just love the opportunity to really kind of get the information from some experts for our patients and to just really be able to educate. So thank you so much.
We are so happy to have
Yeah.
been here. Thank you for the invitation.
Thank you for listening to the Aesthetic Doctor podcast with Dr. Judith Borger. We'd love to connect with you outside of the show. Follow Dr. Borger on Instagram at Dr. Borger and find more online and ways to work with Dr. Borger at www.theaestheticdoctor.com. Until next time, be well.